Hi there, welcome back. This is Kathy Favreau, and today we're going to talk about the levels of care that are available out there. So, obviously, our hope is that we can stay independent and do all that we can for ourselves, and maybe, near the end, we might need a little bit of help, but you know, I go through this whole course because there's a lot of people that need a lot of different things out there, and I want everybody to be prepared. Um, there's obviously people who are very active and healthy into their 80s and 90s and don't need extra levels of care, but you want to be proactive. So, again, we're going to go through them all and talk about what's out there. So, when you first start needing a little bit of help, there's home health care. So, first, let's talk about the difference between home health care and home health services. It's a little itty bitty difference there. So, home health care, you may get a home health aide, which is a person who can put their hands on you or your loved one. So that person can help in the shower, help get dressed, typically does not help with home skills if coming from a home health agency. So, home health, when health is in the middle of the health care, in the middle of the home care, it's health. It's being, it's a nurse, therapy of some sort, PT and or OT, speech therapy might be in there. You might even have a social worker. Um, but there's not as much like home health aides necessarily stepping in. It might depend on what area of the country you're in, and how that company runs. When I did home health, we only had one or two home health aides and they ran like crazy. And then families get upset because that home health aide isn't coming until 2 or 3 o'clock in the afternoon, but their day is full going out to try to like help people get washed up and get clean or whatever. So ideally, yeah, you think that you want to wake up in the morning and have your shower, but that can't work that way in a lot of these when it's coming from the home health agency. Um, I've also worked in home health agencies where whether the home health aide went in or not was a little bit dependent upon the occupational therapist, even. I'm not sure legally how much that really stands up, but they're not there to be your home health aide. They're there to be paid for by Medicare to help get you stronger. So the nurse can be doing wound care, the nurse can be doing checking on your meds and doing your med pour every week. Um, they can be monitoring certain things if you're tending to go into congestive heart failure or whatever's going on medically that the nurse is overseeing, and then you're getting the PT and or OT and sometimes speech therapy. They're only there for a short period of time, maybe a month, maybe two. They're not staying forever. It's paid for by Medicare, so it's not long term care assistance. It is short term to fine tune you, get you as strong as you can be to still live in your environment and not go back to the hospital. That's the plan. So then you can have home care, which is more when you are privately hiring or Medicaid might be helping you pay for a personal care assistant or a home health aide to come in and spend time with you or your loved one. So a PCA, a personal care assistant, that's somebody who's maybe coming in like mom or dad or yourself, whoever can get washed and dressed okay. But, say you have like COPD, like chronic obstructive pulmonary disease. So you can't breathe very well. You have emphysema, chronic bronchitis, or maybe you have a chronic neurological disease and it's slowly, you know, slowly you're losing the ability, the endurance to like do your laundry and to make your bed and to do the mopping. So a PCA can do that type of thing. Can be a companion, come keep you company, do those household chores that you need done, but not put their hands on you and provide personal care. A home health aide provides personal care. It's a different licensure, different training. And so you can private hire those people. You can private hire them through an agency. The difference between an agency and a private hire individual is the fact that if you need so many hours a week and there's a big snowstorm, the provider that's supposed to be coming ends up in a car accident, somebody gets sick or their kid gets sick and now they're short staffed, there isn't somebody that can come, that person that was supposed to be there isn't coming, then the agency still has to fill that space for the most part. But if you hire somebody outright and something like that happens, there is no backup to try to get somebody else out there. So those are some things to take into consideration. But also, the agency is going to charge more because they're going to make a profit on top of paying that person their hourly wage. When it comes to private hire, where do you find them? Nowadays, most of the time, I hear everybody go to care.com. Care.com is a website where people who need babysitting or caring for an older person or even like I think pet sitting and dog walking, like you name it, can all they list what they're able to do, what they're willing to do, and what their fee is. And I hear social workers left and right send people to go looking there. So there's your home care. Now, home health has to be ordered by a doctor. You getting on the phone and saying, hey, I need somebody to come give mom a shower twice a week, that's on you. You don't need a doctor's order for that. You need a doctor's order for the nurse, the physical therapist, the occupational therapist, the speech therapist to be coming into the house. But you don't need a doctor's order for you to say, I need somebody to help give mom a shower, and you calling and doing something. So you don't need to go to the doctor to get that. Again, I talked about in the elder law part about the Veterans Administration. Sometimes if they are established with the VA, there might be some money or supports that the VA can send somebody out as well. So something to consider. The next level of care could potentially be going to an adult day program. So you send kids to daycare, well, you can send your elderly loved ones to daycare as well. So that works out really well for people who have to work but don't mind taking care of them in the evening. It works out great for people who maybe need therapy or need to be looked at by a doctor or something. That sometimes those things exist in the daycare. The adult day hab almost that as you might call it, and those people can sometimes even provide transportation of picking up the loved one and bringing them to the program. Sometimes you would have to be dropping them off. You can go 5 days a week and go twice a week. Like, kind of pick it up as you'd like. It is probably $100 to $300 a day, depending on where you are in the country, for that type of program. But it can be a godsend, especially, if people can kind of stay at home and work from home, but then, twice a week they have meetings, but they can just send dad to the day program and he can, sit and talk with buddies and do activities and have some socialization, which is huge. The socialization component is such a big deal cognitively for people. So many times people want to age in place, but then they're sitting there alone, and we'll talk about that in the dementia part, the lack of socialization and interaction with people is a big problem when it comes down to your cognition, because without those interactions, you're not being stimulated. And by not being stimulated for anything, it actually causes cognitive decline. So your brain will actually make new brain cells. We constantly make new skin cells, new cells for everything. We regenerate ourselves. But those new cells die if you're not learning or stimulating yourself in one way, shape, or form, keeping your brain active. So that's definitely something to think about. Then you have independent living facilities. So an independent living facility is more like your senior apartment. So you're living by yourself. You can take care of yourself. If you do end up with a wound or you're feeling kind of weak, those home health services can come into the independent living facility. A lot of times they'll have a pull cord like in the bathroom and in the bedroom in case you have an emergency, but nobody really works there that's going to come save you. They're just going to call 911 for you. And they can be anywhere from income based on what your social security or your income is, up to like $3,000-$4,000 a month. There's some really nice ones that I've been to that have, all the meals are provided, and there's like, maybe not all the meals. You buy into meal plans, so like 20, 30 meals a month. Depending on the meal plan that you buy into, are provided. They'll provide transportation to like Walmart and like a grocery store once or twice a week, and they sometimes will have activities. The really nice ones, like I'm talking four grand a month. Those places that I've been to have bocce ball courts and greenhouses and indoor pools and weight rooms and their own like little library bookstore and their little like general store to have stuff in your apartments, and their own place of worship, and non-denominational little like chapel. So they can be very small and income based, and people can still socialize and stuff, but not as grandiose as indoor pools and bocce ball courts and putting greens and stuff like that. So depending on what it is that you're looking for and what you can financially handle, those senior apartment living complexes can be very nice. And again, the home health companies can always come into those places as well. And then the next step would be an assisted living. So an assisted living is kind of a big umbrella term, if you ask me. I've been to assisted living buildings that don't offer you anything. They provide your meals, all of them, 3 meals a day, maybe a snack at times, because sometimes they might have like activities, like where they're playing bingo or whatever, and you'll get a snack at bingo. And they do your medication management. That's it. Besides that, you're completely on your own. You've got to be completely independent. All assisted livings will do that. Very few assisted livings take Medicaid, and when they do, it's usually only a couple of their beds, a handful of the beds that they offer throughout the entire building. Most of them are private pay. By private pay being either you're paying for it out of pocket, or you had the finances and the all with all to buy long-term care insurance before, as close to around the age of 50 or younger as you could, when you could get it at a good rate. And the long-term care insurance is paying for your stay there. Now, there are assisted livings that have enhanced licenses. An enhanced license at an assisted living gives you it's usually tiers. So it's almost like an a la carte service. So if you only need a little bit of help, you're like tier 1. If you need a lot of help, you're on tier 3. And if you're like totally dependent for care, then you're a tier 3. So, and I might even reverse that. Different facilities might have that 1 and 3 switched, but they come in tiers. So enhanced means that they actually have home health aides who can provide all of your care. They will change you, help you in the bathroom, get you dressed, put you in the shower, including using a Hoyer lift, which is like a machine that like a sling goes underneath you and it lifts you up like you're in a hammock, and it moves you and puts you down someplace else. They can do all of that with an enhanced license, and with the right licensure and the right like having the machines, having a Hoyer and stuff in the facility, having the right equipment. What separates them from a nursing home is that you're not getting the nursing care. So that was an awkward pause, I know, but you're not getting the nursing care. So you're getting the personal care. And from what I've seen, the personal care at an enhanced assisted living is far better than the personal care you're getting in a nursing home. But if you need an IV, if you have, you know, any type of things that need a doctor or a nurse overseeing you on a regular or daily basis, that's not happening at an assisted living. If you have a wound or something that needs to be monitored, that's going to be a home health nurse that's coming out from the home health agency to do that for them. There's RNs on the premises. They're overseeing the building basically for the most part. And if somebody has a drastic change in status, that RN is doing that assessment and calling the doctor, because there is a doctor that like is the director of the assisted living, will call them and say, you know, there's something going on with such and such a person, or call the family and, you know, call 911, whatever their plan is. There is an RN on the premises, but they're not licensed to provide. The RN is licensed. The facility is not licensed for that RN to provide nursing care that goes beyond what an assisted living is allowed to do. So, for those type of things, if they need IVs for some reason, they're going to the hospital. They're not going to get the IVs there in the building. You can have hospice in an enhanced assisted living. People can live in an enhanced assisted living on hospice care, and hospice can bring in a hospital bed, and hospice can oversee them transition through the end of life with the assistance of the home health aides that take care of people at the assisted living, which makes it close to nursing home, but hospice is being responsible for them. So hospice will still see you through end of life, no matter what level of care you're in, whether you're home, an assisted living, the hospital, the nursing home. Hospice will come in and see people anywhere. So that's not really a game changer. So an assisted living can be anywhere from $2,000, $1,500 to $2,000 for the real, like, you don't get anything, depending on where you are in the country, to really enhanced services being about $13,000 a month. And again, that's where the long-term care insurance is really helpful. So then a skilled nursing facility. So a skilled nursing facility is just that. That's why it's called that. They have the skilled nursing tasks that they can perform. So they're going to be looking a lot more closely at being able to like give the IVs or a crisis, which is a way of keeping somebody hydrated, or, you know, assessing some of those more ill people more closely, and always have a doctor on call who's responsible for them, be able to change up orders and start things quickly. It's more of a subacute rehab that can give you the rehab that you would need to get stronger in a longer time frame than in an independent rehab facility, where you're doing like 3 hours of therapy a day, and they have nurses and doctors there constantly as well. But it's not a level of care like to live someplace the way it is at a skilled nursing facility. And therapy and nursing and everybody tries to work very closely together at a skilled nursing facility. But there's definitely like the downfalls. I mean, they have all their meals provided, and they have activities, and they have all those things as well. Especially in this post-COVID world, they are a lot of times very short-staffed. The doctors aren't there all the time, so they're usually like, they make rounds once or twice a week, and then they're on the phone. with the nurses. If there's any issues or changes in status with anybody, they can give orders that way. They're on the computer looking at lab results and stuff. They'll order new labs. Like, they're on top of things for the most part. But you're not going to get as acute care as you do in a hospital, but you're going to get more medical assistance than you're going to get in an assisted living. And then you have your continuum care retirement communities, CCRC. That is someplace where the facility, the company that owns the facilities, buy a large plot of land. And they put the independent apartments, your assisted living, and your nursing home all on the same lot of land, and tell you you buy in for tens of thousands of dollars, if not more, into our community, and then you still pay monthly, and then you're going to, but if you need the next level of care, you can go from being in the apartment to going to assisted living to going to a nursing home whenever it is that you need it. My only distaste for these communities is not only do they take in a ton of money to buy into the program, but I've worked with tons of people who pay for that, and then they think while living in that assisted living or living in that apartment that when they have to have surgery or they fell and broke something, that they would automatically just go to that nursing home for the rehab, and then they're told there's no room for them there, and then they get sent to someplace else for rehab. So they're still not staying in that community. So those are definitely questions I would seek to answer, to find more details about any of the CCRCs in your community that you might be interested in, because they are very pricey. And even though it sounds like you always get to stay in the same community, it may or may not always work out that way. And again, it is very pricey, and it all depends on their availability. So, and then lastly, I want to talk a little bit about PACE. So PACE is actually from a government based program. It kind of falls under, if you've ever heard like the phrase nursing home without walls. So it is Medicaid funded. And if you don't have Medicaid, you can pay monthly for the service in most places. Again, because it's Medicaid funded, it varies from state to state because Medicaid is a state-run government money, if that makes any sense. So, so if you're a part of PACE, you can be home getting all your nursing home care. So you can be home, and a home health aide can come in and get you ready in the morning and help you out the door, and the bus comes and picks you up and takes you to an adult day hab where you spend the day or a few hours a day or whatever, because that's where you're getting your PT and your OT. And you might see a doctor or something there, and they're going to give you your meds, and you're going to have some activities, or whatever. And then you're going to leave there and come back home, where another aide is going to be there to like make you dinner or help you get ready for bed. And, somebody else might swing by the house again later. All those things are provided by them. So any of your help at home, going to a day program, seeing a doctor, it's their doctors, their nurses, their therapists, their everything. Now, if you do need to go to an inpatient rehab because, say, you had a surgery or you broke something, those people, those therapists from that PACE program come to the facility and check in on you. And they actually participate in your care conferences and talk about your discharge with them to see if you are still a good candidate to come back home with their services, or if you really need to be in a facility. The difference here being is that they usually are not going to be using a bunch of lifts and stuff with you at home like they would in the nursing home. Usually you still have to be a one assist transfer with one person. They're not going to pay for the Hoyer lifts and the two people coming into your house and all of that instead. So there is always a risk that you might end up having, if you need that level of care, that you still might end up needing a nursing home at some point in time. But it's a great program to try to stay at home as long as you can, depending on the degenerativeness of whatever's happening. So I hope that gives you a little bit better of a breakdown as to what each service is and how you find it and whether you think you would need it or not. So my recommendation as we're going through these classes and we're being as proactive as possible is to take this list now of what these different places are and then look around your community and find which ones you have that are like that. And then you can even take a tour, depending on COVID. You can take a tour of them, or you can take a virtual tour online. You can ask them some questions. I left some questions on your handout that the ARP came up with. That I thought was really good. So I wasn't even going to try to make up my own. I just liked theirs, and I'm telling you, AARP put it together, and I loved it. All the questions they came up with. And then you can also go to the website, your Department of Health or CMS.gov, and you can look at what their ratings are. So they all get audited by the Department of Health every year. Nursing homes are definitely Department of Health. I think most of these are, like it's JCAHO for hospitals, it's Department of Health for most of these facilities. And then if they've had everybody has deficiencies. Everybody has deficiencies. Look up any restaurant you've gone to. Everybody will have at least one deficiency, even if it's just the water lines. Like there's always going to be something that nobody's ever going to walk out saying that you're a perfect facility. It'll never, ever, ever happen. But you can look and see how bad, how significant some of these deficiencies or tags were and what their rating is. I know in New York we have a star rating now, so you can say that it's like a 3-star, 4-star, whatever facility. So you can keep an eye on that. And I would recommend that if you do that, to have a proactive plan for what's around, that you revisit that. I would say at least every 12 to 18 months. Because sometimes these facilities have either had a change in ownership, a change in management, a change in pandemic, whatever, and things are not the way they were when you first looked at them. So it's definitely worth it. Take a look and see, make sure that it's still the facility that you think it is by the time you might actually need them. The other reason why I really want you to pay attention to the skilled nursing facilities in your area is because if your loved one goes to the hospital and they do say that they need rehab, then there are rehab hospitals, IRFs, rehab hospitals, but you have to be accepted into them twofold. They have to accept you in thinking that you're going to be able to tolerate 3 hours of therapy a day, and your insurance has to want to pay them because they cost more. And if that rehab hospital does not take you for rehab, then you have to go to a subacute rehab unless the family is going to sign out and say, I'm not letting them go to a facility at all. I'm going to take them home and take care of whatever they need on my own. So your subacute rehab happens in those skilled nursing facilities. So if you're in a hospital and the rehab hospital is not going to take you, so you're going to end up going to a nursing home for subacute rehab, then the case manager on your unit, that's usually an RN, is going to come around and they're supposed to say, where would you like to go? And they're supposed to have a list of places in your area. And then you are supposed to come up with 3 or 4 places to circle as to where you would like your loved one to go. And that's where they're supposed to go first. It doesn't always happen. Sometimes they just come to you and say, your loved one's going to such and such a place, or your loved one, and that's not how it is. So I'm saying all that, and we'll get into that deeper in other conversations as well, that you then have the knowledge and the advocacy now to say, no, where's my list? You're supposed to give me a list of places because I want my whoever I want you to send that PRI. A PRI is called a patient review instrument. It's something that case manager fills out to send to whatever facilities it is that you're trying to get them into, that says what level of care they have, how much therapy they've had in the hospital, what their diagnoses are, and what their chances basically are of getting better, that gets shipped out every place. So you say, I know that you have to do that PRI and I'm supposed to have a choice. And these are the places that we've already selected. Bam. That is part of that proactive plan to live on your terms and know where it is that you're going to go and what you're going to expect, and therapy that you already understand, and all of it right there. So definitely look at what is available to you. There's not as much out there for home health companies. Each county has to kind of like approve for another company to come in. So a lot of times you're only going to see one or two that would actually come out to your house to begin with. The adult daycares, again, there's probably not a ton of those. There's a lot of independent living, like senior apartments all over the place. And if you have a local office of the aging, it's called a little bit different in different states, but a different program in your county for people that are seniors or aging, a lot of times they might have a binder that they'll give you. A spiral bound book, more than a binder, of all the different facilities in like a few counties around you, what the names of them are, if they're income based or if it's a flat fee, what their rent is, what their layouts are, the contact numbers, and you can look into it from there. And then same with your assisted livings would be in that book, and your skilled nursing facilities should be in that book if your office of the aging puts anything like that together, like mine does. But definitely be prepared about the skilled nursing facility too, so that if you ever do need the subacute rehab, you have a plan. All right, it's a lot to digest, and a lot of research and stuff to do for your worksheet on that. So good luck with that, and I'll see you soon.